At this point, we are going to take a look back over the last 4 days. We spent some time discussing domestic homicides in Canada, and we're going to discuss where do we go from here? What is the road ahead? So hopefully most of you have joined us over the past 4 days, and I think many of you who work in this area or know this area know that domestic homicide is clearly an issue in Canada. It's a significant national problem, but it's also a problem that is exhibited globally as well. And recently, the United Nations Office of Drugs and Crime has said that there actually has been little improvement or progress on preventing domestic homicides, particularly when they impact women. And, this is probably quite disheartening for many of those of you in the audience or across the world who have worked for the past 4 decades on implementing legislation and social change with respect to this. So we have to start to wonder, what is it that we need to do more? So where do we go from here? And one of the things that we have identified is that this clearly is, while there are both male and female victims of domestic homicide, women are disproportionately impacted. And we've shown that both in our work that we presented on Tuesday, but also in the most recent statistics that have come out from StatsCan, which show that females are 8 times more likely to be killed by a male spouse or partner compared to a male victim. When you take overlapping identities, so we know that sex and gender is just one identity. When you overlap other identities with one sex and gender, then that risk increases substantially. And so we focused on 4 populations in this project, recognizing that these are not exclusively the exclusive groups that experience high risk, but they are a first step for what we focused on, and that was Indigenous populations, immigrant and refugee, children, and those living in rural, remote, and northern populations. And as we discussed on Tuesday, if you were with us, from 2010 to 2019, over a 10-year period, we had 718 domestic homicides that involved 815 victims and 760 accused. And I think it's important to highlight here that there was another 254 cases, 254 victims that could have been domestic homicides, but we just didn't have enough information to make that determination. So our estimates are very conservative and are likely much higher. Within that group, vulnerable populations were identified as accounting for over half of the domestic homicides, just focusing on the 4 populations that we focused on in this project. Over to you, Peter.
On day 2, we summarized some of the highlights from our surveys with professionals working across the country, providing support for victims, perpetrators, and children living with domestic violence. The survey data and the Keen for interviews suggested that we need to do more on training on risk assessment, and not just risk assessment, but also making sure risk assessment leads to safety planning and risk management. And we've seen that repeatedly in the interviews we've done across the country. We've also seen that we fail when it comes to really meeting the needs of vulnerable and marginalized populations. It's clearly, as many people have said, it's not a one-size-fits-all. Not everybody feels safe in calling 911. And in some places you call 911, it'll take a day for somebody to fly into your remote area to provide assistance. Or you might be left behind in your area and not really have any supports in place. A key theme that we've seen from the interviews is the need for collaboration across systems and agencies. We see too many professionals, too many agencies working in silos and not really sharing information, not really having protocols and policies in place that help them work together to prevent homicides. There needs to be a greater agreement on the tools that people are using. People need to communicate across systems and across agencies, and it is essential that people have some sort of risk assessment tool, some sort of risk assessment strategy that would lead to some structured approach to identify the level of risks, but also the implications of those risks for interventions. And clearly a theme that we've seen repeatedly. We've seen too many cases from the interviews we've done where risk assessments weren't done, and when they were done, they're lost in a file somewhere. Risk assessment has to lead to safety planning and risk management. As we listen to Julie and Annalee and our colleagues talk about the research from looking at the voices of survivors and victims across the country, there's some pretty clear messages. First of all, help seeking is challenging and exhausting. And I hear that repeatedly. Actually, I have clients who are lawyers and physicians, and they have trouble even with funds to access the system, navigating the system, making sense of it. It's an exhausting system, and many victims, survivors move forward without any advocates helping them through the jungle. We can't overlook the impact of trauma when survivors seek help. Survivors may be suffering on an ongoing basis from their past trauma. There may be addiction issues, mental health concerns that arise from years of trauma. And the trauma isn't over when the violence is over. The trauma continues and may take different forms, and it actually may continue through the court system. Leaving is a process and not just an event. And we know from the stories of many survivors, their experiences, we know that it's not calling the police one day and leaving. Leaving often happens repeatedly until somebody can be finally free of the violence. So we have to recognize the ongoing process. Many survivors have talked about the fact that this violence can happen to anyone. And we had a number of survivors speak very eloquently to domestic violence as something that you see on television, you might read about, but you don't really think about its impact until it strikes your family. And then you have to do a lot of learning in a hurry. So clearly, this is something that everyone needs to know about. Family, friends, good neighbors, coworkers. We need to listen more to survivors about their experiences and judge them less. And we know now that there's so many layers of oppression to navigate. We've heard so many powerful voices. I'm left with many of the voices from Indigenous women living in rural and remote communities who found such a challenge to get any kind of assistance and support within their community or from outside agencies. So these are important issues for our ongoing considerations.
So one of the things that we wanted to emphasize here was the challenges and the benefits of incorporating key theoretical frameworks. And we did really use and draw from three overarching frameworks when we started this project 6 years ago. And the first is the social ecological model. The second is it's a framework, but it's also a methodology, and that's intersectionality. And then exposure reduction and retaliation. I just want to briefly talk about the first two, and then Peter will talk about the third in terms of some of the benefits and challenges of doing so. So this is the social ecological model, and this is usually when my students go to sleep, but hopefully you'll stay with me right now. This was a model that was developed actually for early childhood development, but it's been very much taken up by the World Health Organization in terms of understanding how we need to respond to all types of violence, but in particular, it's related to domestic violence as well. And it really underscores the fact that you cannot focus on a single factor that might increase perpetration or victimization. So you can't focus on just mental illness, just substance abuse, or just childhood maltreatment or poverty. And you can't just focus on one level. So here we have the individual, relationship, community, and societal level. Our interventions as a society can't just focus on one of those levels, because these levels are interacting and reciprocally affecting each other at all times. And so risk and safety really does have to move beyond the individual to the relationship and to the community and societal. We have quite a bit of information on individual and relationship. And if you were with us on Tuesday, we talked about the fact that the data that we got in the database, while problematic in some respects, still emphasized individual and relationship. And so one of the challenges that we faced in this project was actually figuring out how we get that information on community factors and societal factors, and knowing that they are perhaps now the most important factors to focus on if we're going to progress further with prevention. The other lens that we looked at was intersectionality. And for those of you who are familiar with it, it originated from the Black feminist movement in terms of identifying the identity of Black in combination with gender as overlapping oppressions that led to different experiences for Black women. And it's really been taken up quite quickly by by lots of communities, lots of researchers, sometimes good and sometimes not so good. And we tried to use this lens to focus on risk and safety within the populations that we focused on. And on Tuesday, we did talk about some of the intersections that you could see across Indigenous and children of rural, remote, and northern, immigrant and refugee, rural, remote, northern, and children, and so on. So we did have some intersections. But again, coming back to the data, the challenge was getting those identities and some of those multiple identities that continue to overlap and cause and compound risk to domestic violence. So these two lenses were extraordinarily important in the research, and we constantly had them in the backs of our mind when we were doing this research. But over the course of the data collection for the database, as well as phase 2 and phase 3, we faced real challenges in actually being able to incorporate social ecological framework, so looking at community and society, as well as some of those overlapping oppressions. And I think one of the ways that we need to move forward is figuring out how we can pay more than lip service to both these lenses when we're looking at violence and domestic violence in particular.
The third lens is the exposure reduction and retaliation. And I can tell you, I used to be like one of Myrna's students. I fell asleep when she first explained this to me and went over several PowerPoints describing it because it seemed like such common sense. But actually, it's a very critical theory, and it should really inform what all agencies and systems are thinking about as they try to protect victims from ongoing violence and potentially lethal violence. It's the important point, I think, in the theory is that the more we do to reduce the likelihood of violence or exposure to violence, the more we do to reduce harm to victims, the more we can do to protect them. However, and this is a very important however, if you do things that are only half-assed, and I'll use that expression very, very directly, if you only intervene, for example, if you all support a policy that domestic violence is a criminal offense and the police lay charges, and then the perpetrator gets out and no one is doing any surveillance, and the perpetrator goes right from the police station back to the victim's home, all you've done is made it worse. So that's why the theory talks about exposure reduction and retaliation, that the interventions have to be effective and consider safety planning for the victim. And there's been a number of cases across Canada, and I'll just use a concrete example of exposure reduction and retaliation. There's a number of cases where the police lay criminal charges, the Crown Attorney pursues these charges, and then they get resolved through a peace bond that tells the perpetrator to stay away from the victim unless they have children together, and then the perpetrator is allowed to contact the victim in order to arrange access to the children. So it's one of those situations where on one hand it recognizes the violence, on the other hand it just opens the door for ongoing violence and the potential for backlash or retaliation. If you look at the next slide, again, it's important to really look at these references in more detail. Today, I'm just really dealing with them at a common sense level. And the important point is that prevention does work, but the prevention strategies really have to be tailored to an individual context. I've been involved in a number of cases across Canada that involve northern and rural communities where there's a good attempt to recognize that the violence shouldn't continue, but then the victim is left by herself within a community with no support due to isolation and various barriers to access resources, and the violence against escalates. So reducing exposure to harm is a small step, but if we only reduce exposure to harm but leave the victim vulnerable to ongoing retaliation and repercussions from the perpetrator, we really haven't achieved as much as we wanted to achieve. And in fact, we may be making a bad situation even worse. So this, I encourage you to do more reading on it, because it really should inform the things that we're doing. Just as an aside, I was at a meeting recently where I found out that some police jurisdictions actually will red flag certain perpetrators and will actually follow them when they're released from the jail or from the courthouse. And the police who do that recognize that doing that could save lives, and other police services don't understand how this is a good investment of dollars to reduce homicides and repeat violence. As we reflect on promising practices that make a difference, there's some themes we've keep coming back to over the last 4 days. Public education. If you think back of the social ecological model, we have to get to the outer circle. We have to get to the media. We have to get to friends, family, neighbors. We have to make sure that during the Stanley Cup finals, between periods, there's public service announcements that deal with domestic violence and the roles and responsibilities of friends and family. It's not just the occasional brochure that may be in a doctor's office. It has to be way beyond in terms of public education. Professional training across all sectors. And training means more than just an hour session. Training means longer sessions. It means collaborative training with different sectors. It means hands-on training about what a risk assessment means. A risk assessment is not putting a bunch of check marks on a piece of paper. Risk assessment is thinking about the nature of the risks that are present. Safety planning for victims, ensuring that the victim has access to safety and support and can leave a dangerous situation quickly. And risk management. Obviously, we can't keep finding more places for victim to run and hide if we're not dealing with the perpetrator. So how do we manage the perpetrator? How do we ensure the perpetrator is part of meaningful interventions that hold them accountable and in appropriate cases open the door for healing? So clearly risk management has to be part of what we're doing, and finding ways to deal with perpetrators is critical. And again, collaboration is everything. There was a book written years ago by Ed Gondolf on batter intervention, and one of his concluding chapters title was "The System Matters." The system matters. Basically, it takes a whole village to protect a victim. You can be a terrific police officer, you can be an outstanding probation officer, you can run a great batter intervention program, or you can have the best shelter in the country. But unless you're working collaboratively with your partners, you can only go so far in terms of saving lives.